Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Cancer is a leading cause of death around the world, making cancer prevention a key subject that we all need to think about and maybe adjust our lifestyle. So we're talking with Dr. Cyrus Hajiran about that today, about what we can do to be our very best and try to avoid the diagnosis of cancer. Thanks for being here.
Thanks for having me.
What kind of lifestyle changes can we make to avoid a cancer diagnosis?
Sure. So the American Cancer Society just came out with a report in January that cancer incidence, or people being diagnosed with cancer, is happening more a younger and younger population, and have tried to strongly advocate for us to take charge better about changing our lifestyles to leading healthier lives and earlier screening to try to catch this earlier incidence of cancer. Lifestyle changes, full picture, are all important in development of cancer and trying to prevent cancer, including what we eat, how we move our bodies, avoiding risky or toxic substances, and trying to just take care of ourselves overall.
So how we move our bodies, it doesn't necessarily have to be a full-fledged workout, but moving frequently throughout the day, does that make a difference?
So there are, there's evidence in the literature suggesting that both obesity, so excess weight in and of itself, can be associated with a higher risk for developing several types of cancers, in addition to just inactivity, even if you don't have obesity. It all goes back to different types of inflammation and harms that can affect the different cells in our body. So it's about both movement and excess weight.
Let's talk about what cancer screenings are available for adults. How often should you be doing that?
Sure. So different cancer screenings are based off of the different organs that we're looking at, and what your age is. Also, if you are a biological female or biological male, what organs you have to screen for cancer. It's different for every organ, really. So maybe just to start arbitrarily with cervical cancer. If you have a cervical cancer, by the U.S. Preventative Services Task Force starts at age 21. The American Cancer Society and the American College of Obstetrics and Gynecology all maybe give slightly different variations of when you screen, so it's best to talk with your doctor about deciding what's best for you. But usually that starts with cervical cancer screening, age 21, and we do a pap smear for that, with or without HPV, human papillomavirus co-testing, and that could be anywhere from every 3 to 5 years based on the test result, sooner if an abnormal result comes back. Another one for a patient who has breast cancer screening. The same thing, kind of, where there are a few different accrediting societies. The College of Obstetrics and Gynecology, Cancer Society, U.S. Preventive Services Task Force, all give slightly different variation recommendations, but 40 is what I use, and usually yearly is where we start. For colon cancer starts at age 45. There are two major ways we can screen for colon cancer. One is called a Cologuard. It's a fecal test where we test for cancer DNA. The other is colonoscopy, where you do the bowel prep and you have the scope. The stool test can be good for 3 years if it's negative. If it's positive, then we go for a diagnostic colonoscopy. The colonoscopy can be good from anywhere from 10 years or shorter intervals based on what we find during the colonoscopy. Prostate cancer, for people who have a prostate, is a little bit controversial as far as the screening, again with different societies saying different things. But I start at age 55 with a prostate-specific antigen blood test, and repeat that yearly or sooner based on that result. And the last big one is lung cancer screening. That can be ages 50 to 80 with a certain amount of smoking history. So you talk to your physician or provider about that, and usually that's a yearly type of screening.
That's a list that can keep you and catch it early, and early is always the best way to conquer it.
Yes. I always ask patients when we talk about cancer screenings and them being hesitant or maybe even think that it's not important for them if they feel fine. I asked them if they were diagnosed with cancer today, would you want to treat it? And a lot of them say, well, yeah. And then I ask, how would you know if you have it or not if you're not doing these screening tools? Because lots of times we catch cancer in the early stages before you don't have any symptoms, which is always easier to treat rather than if you have your first symptom like rectal bleeding or bleeding in your urine or a lump or a bump, because at that stage sometimes it's more advanced or aggressive and it's harder to treat.
Yeah, the earlier, the better, and better outcomes.
Right.
Dr. Hajiran, thank you so much.
Sure.
It was great talking with you today.
Thank you.
Thanks for checking in for Monday Health Minutes.